Hi everyone. Today I'm going to be retiring these glasses because I'm going to be getting LASIK. I'm a little nervous, guys. I'm a little nervous. Just trying to hold it together and pull through. The last 24 hours have been kind of nerve-wracking. From what I hear though, it's not that bad, so we'll see. I'm headed to the appointment now. I have my dad driving me because you have to have somebody drive you to and from the appointment. Yeah, it's 12:37. The appointment's at 1. See you guys after. These are the tips that they gave you the day of eye surgery. I don't have any contact lenses. This specific location provided me eye medication to artificial tears, told me to eat a meal, educate yourself, take medications, wear comfortable clothing, be natural, meaning do not wear any kind of cologne or perfume or anything with heavy fragrances, and bring a friend or family member to drive. Just came back from my surgery. I would say the actual operation itself, for me, it was kind of difficult. It was very uncomfortable for me. Like, if it was a longer procedure, I definitely wouldn't be able to do it. I think it probably took about 5 to 10 minutes for the actual procedure itself. The uncomfortableness probably stemmed from the fact that they put like this clamp in your eye and you gotta relax your eye or else you'll feel like the clamp because you're like squeezing your eyeballs if you don't relax your eye, and I have trouble relaxing my eye when I have anxiety. So they did give me something to help with that, and I feel like it did help a little bit. So I am 1 day post-operation, and I'm about to let you guys know all the deets that you need to know for the Lasik eye surgery. To be honest, when I was watching the videos, a lot of times people were saying it doesn't hurt that bad. There was nothing that really hurt. For me, it was very, very uncomfortable. Like, if I could rate it a scale of 1 to 10 of uncomfort level, I would rate it at least a 6 or 7 for me personally. It's not that it hurt necessarily. It's still surgery, so keep that in mind. Like, I know a lot of people be like, oh, it's not that bad. It's just, and it really isn't that bad just because it's not very long procedure. Once it was done, it felt like it was like 5-10 minutes maybe. After the procedure, immediately after, I didn't have any problems seeing. I could see things. I could see the clock and the little number, so I knew that it had worked. But I would say about 30 minutes to an hour later, I thought I could go and see my grandmother and, you know, just do my daily activities, even though the surgeon had said, don't plan on doing anything today, just rest, just rest, just rest. And I kind of ignored that a little bit. I was like, well, I can go see my grandma first. And that was a mistake because it hurt like hell. Like, my eyes were just burning, tingling, and everything was just kind of like irritating me, like bothering me, the lights. I could open my eyes, but it just hurt so bad to open my eyes. So I just rested my eyes from about, I want to say 3:30ish to about 8 o'clock, and then my eyes finally felt good enough where I can open them and see everything going on. I ate dinner because my procedure was at like 1, and then I went back to sleep. Like, even now, my vision, it isn't crystal clear yet. Like, I could see pretty far away, things that I couldn't see before, but it is a little, I would say, hazy, because people said it was gonna be like super blurry and cloudy. For me, I didn't really get a blurry or cloudy view. It was more like it just hurt so bad to open my eyes. Now it's a little bit like how your eyes get when it gets super watery. That's how my eyes are looking. Like, I need to wipe my eyes a little bit. I'm trying so hard not to touch my eyes because that's what the doctor said. That's the most important thing. Don't touch, don't rub your eyes. And so far I haven't, but it does just feel like something that's in my eyes, or like I need to itch it, but it isn't anything unbearable right now. Here's the post-op instructions that they gave me. So these are the pill vitamins that they gave me. And I had to take 2 pills in the morning and 2 pills at dinner time. And I really like these pills. I mean, they are pretty big. They gave me this, which is like a medicated drop that they specially make, so you can't just like get it from any kind of drugstore. Anyhow, so you got to shake this very well before use and use it 4 times a day for a minimum of 5 days. And this burned my eyes a little bit. They say it has like a bitter aftertaste. I didn't notice a bitter aftertaste. It kind of tasted salty to me more than bitter. And if you do need a tip for like how to take drops, because I never took drops before, and I'm someone who blinks chronically, so like especially when something comes close to my eyes, I watch videos on how to apply it properly, and like pulling down your like eyelid helps a lot with making sure that the drops get in your eyeball. Just pull your eyelid and then just try your best, focus on something else or think about something else while you drop it in your eye. Then they gave me 2 containers of these, and I definitely used it all. So I don't know if you'll be able to see, but it's like the artificial tears, and this is what you use most regularly. I've seen some people being recommended taking this every 30 minutes, but they recommend it we take this every hour for at least the first 7 days. The medicated 4 times a day for a minimum of 5 days. This I took once an hour for 7 days. Then after that, I took it once every 4 hours for the month. In the instructions, they say that you can't over moisturize your eyes, so you use them as much as possible. So anytime you feel any kind of like urge to itch or like you have dry eyes, take them. And they also can be refrigerated for your comfort or to make sure that you know that you dropped it in your eye. This should not burn your eyes. This is a relief. Once I ran out, this is the kind of drops that I got, and I still take these now. This kind, and I called them to make sure, and they said that these were fine. And it even says it helps with LASIK dryness, and it's preservative free. I got this from Costco, so you get a good deal, and I still have a bunch of tubes in here because I was loading up on this. They gave me 2 bottles, and I definitely went through it within the first 2 weeks, I believe. So then this is the last drop. This is a lubricating eye drop. I'm only supposed to do this a maximum of twice, 2 or 3 times a day, but it's not really in the daytime that you're supposed to use this. You're supposed to use this at night. So before you go to bed, right when you wake up, and if you wake up in the middle of the night, I was instructed to also use it. So 3 times max. Don't use it any more than that is what they told me. I will say it did help a lot with the dryness that I had overnight. So I started doing all of this like the day after. They recommend you to do it like right after you wake up from your nap. The following days you should be able to drive. I will show you guys the post-op instructions. Hey everybody, so I think it's day 3 since I've had the operation, or is it day 2? I'll let you guys know because I can't remember off the top of my head. But I will say I have noticed some different symptoms that I haven't had previously. First, I'll start off with last night. Last night I did put like those blink drops in my eyes before I went to bed, and I did notice that in the middle of the night when I woke up, my eyes were kind of dry, so I had to put some more of the blink stuff into my eyelids. Really, I didn't suffer from dry eye before this, and throughout the first few days and few hours I didn't really have too much dry eye, but I did notice that I had dry eye last night. And I will also say that I put more of the blink drops in my eyes this morning as instructed, and then I also put the medicated drops. And when I put those medicated drops in, my eyes started burning. I'm not really sure, you know, what's causing this. My eye is still healing, of course, so that's probably what it is. I will keep you updated on how long my symptoms last and how long until my eyes are fully healed. My eyes are still a little red at the top of my eyes. I won't show you now because I'm driving and my eyes are a little sensitive to light, so I have my sunglasses on. All right, talk to you guys later. We're gonna go back to the treatment date itself. The day of treatment, I was very, very nervous. I had a lot of anxiety. I did ask before the surgery for Valium or some kind of anti-anxiety pills, and they did give me that. So if they don't offer it to you, make sure you request it if you're someone who has high anxiety levels. You know, when I came in, they had me sign the paperwork. You have to sign it when you are fully aware, so you can't take your medication until you sign all that paperwork, and then they'll tell you when to take the Valium. Then I sat in the waiting room, and there was like 3 or 4 other people ahead of me. I would say like I sat in the waiting room for about 40 minutes to an hour, before they got to me. The medicine kicked in, but I wouldn't say that it completely alleviated my anxiety. I actually still had a lot of anxiety going into the surgery room. Like, they do put a clamp on your eyes to help it stay open, and honestly I couldn't really tell what was going on because it was such a quick surgery, number one. My anxiety was kind of high. I mean, you really can't see what they're doing with your eyes if they have it clamped, and there's things that they put over it, and then it was a lot going on. So I couldn't really tell you step-by-step detail, but I do know that they put that little clamp thing in your eye. I remember what the name of the tool is that they put over your eye after you have the clamps in, but it makes it feel kind of like pressure. Like, a lot of times people say LASIK doesn't hurt at all. For me, it felt like it hurt. Like, I don't know if it hurt or if it just felt uncomfortable, but to me, it's hard for me to distinguish those two feelings. So it felt uncomfortable and like it hurt to me. So it was pretty quick, but I wouldn't say it was painless or like, oh, easy breezy. They did give me like stress balls to squeeze to help alleviate some of that anxiety and stuff. Got out of the surgery alive. The second I get out of surgery, they tell me, oh, you're all done. I couldn't believe how quick it was. I sit up, there's a clock across the room and I can see it. Before surgery, it's hard to describe. Like, I had bad vision, but I wasn't really aware of how bad my vision was. The time that I would notice my vision being bad is when I'm driving, because I wouldn't be able to see signs and stuff. But like close up, I could see very clear. Far away, can't see at all. I definitely wouldn't be able to see that clock or pretty much anything, like people's eyeballs. A lot of times I couldn't see if people were looking at me, but now I can see. 2020, I would say that the results for me were pretty instant. It was a little hazy, but it wasn't too bad. Like, I know a lot of people report that it was super foggy. I did have my dad drive me back home. I did keep my eyes closed because I couldn't open them. I opened them, I was miserable. Even with the sunglasses. And I did lightly sleep. I just wasn't in like a deep sleep. I could still hear things going on around me. And I felt better after about 6 to 8 hours. My eyes were still dry, I would say, for the first 3 to 4 weeks. After about a month, it mainly just is dry when I go the whole day without, putting drops in my eye. I would definitely recommend somebody take off work, because especially if you're really busy at work, like, you're probably gonna forget to do it. I got it on a Friday. But yeah, I had 2 or 3 days off of work out of 7. So that helped me to really focus and make sure that I am putting the drops in as frequently as needed, because that's also a very, very important part of your recovery. Because some people will have, I don't remember what they call it, but basically their eyes can degrade in quality or visual acuity because their eyes are so dry. So making sure that your eyes are lubricated is a very, very important part of the healing process. Now, I did not have any kind of halos, and the doctor did say that it should help with the halos that I get around cars, because with glasses, I had really bad halos, and that's kind of what made me lean into LASIK. But I know a lot of people have halos around cars as like a side effect. Personally, mine's is not any worse from having LASIK. If anything, I would say it's better. So personally, I don't have any issues with the halos, but I know that is a pretty common side effect of LASIK. I do kind of have a little bit of fluctuating vision, not as much anymore. They do say that it can take months for your eyes to fully stabilize after getting surgery, so that is something to be aware of. Overall, I would definitely get the surgery again. I haven't had any problems yet. Some people report that when they have it young, like when they have it at 19, they notice that their eyes start getting bad again, because your eyes are still growing and changing until you're about 24, 25. I would definitely get it again. Like I said, like there was for me uncomfortableness and pain during the operation, but the following weeks it wasn't anything unbearable. Just put those eye drops in, wear the sunglasses to bed, and you will be fine. If you're curious, this is the institution I went to. It's the LASIK Institute, and it's located in Southfield, Michigan. The price, as you guys probably know, it is pretty expensive, but in my opinion, it's worth it because of the amount that a lot of people spend on glasses. I used to get the really good deal too, for like $100 or $80 or whatever from America's Best, but a lot of times it went up with the more features you added to the glasses that really made it beneficial. Over time, that adds up. And LASIK is really supposed to be a procedure that lasts you a long time. Treatment quote that I received marked my treatment as costing $4,700 For each eye, that would be around $2,300 per eye. There was also other costs that was included in that treatment quote, and that included the teardrops, this vitamin that they wanted me to take, and the medicated drops. But I ended up paying less than that. There was a $1,000 off discount, and then in addition, I did have a FSA, a flexible saving account, and that did help me pay for this procedure. I had 2 meetings with them. The first meeting was basically just like a test. They did a series of different eye exams to see if I would be a good candidate, to see like the thickness of my cornea. Eye pressure is like a general vision test that you take to see what your current prescription level is and to see like how bad your astigmatism is, because all of those are factors that they look at when determining if you're a good candidate for LASIK. I came back again for a second visit because they wanted to dilate my eyes. The original appointment that I had, the doctor wasn't in, so they had to wait in order for the doctor to come in to dilate my eyes, and then they did the vision test over again with my eyes dilated. I do feel like all of the staff were really informative and really helpful and honest. I had a lot of questions, some of which being like, what happens if I get a really bad urge to rub my eyes, because that was really what was causing me a lot of anxiety and a lot of hesitation about the surgery. The consequences that could potentially happen if you do have your surgery. And I would say that they were very honest and informative of the pros and cons of LASIK. The only thing that they didn't really explain, in my opinion, although you should also do additional research, that they did not really explain to me very well, that I learned in the process of researching LASIK eye surgery on my own, is that the procedure that they do will be permanent in terms of like the flap that they create in your cornea. It will always be there. I thought eventually that it would heal and just like go back to normal, but even though your eyes will heal and you will be able to like see perfectly fine and everything, you will always have that flap in your cornea, which is important to note. I'm not like a doctor, so you should definitely ask your eye doctor to explain it better to you. But from my understanding, complications that result from that flap that's in your eyes are very, very, very rare. They did provide a recovery pamphlet to tell you the importance, do's and do nots. It says rest. I was feeling fine right after the surgery, but then about an hour or 2 hours after, I was so miserable because my eyes were very, very sensitive to the point that it was just kind of like overwhelming. It says avoid screen time. Avoiding screen time is also kind of important because you will have dry eye probably for the first month after the procedure. At least that's how long I had it. I still kind of have a little bit of dryness, but it's not as bad as the first month, especially during the nighttime. Like when I first woke up, I definitely had to put those drops in my eyes because my eyes were so dry. It tells you to avoid getting water in your eyes. I still don't get any water in my eyes. If there's something that feels like it's in my eye that I need to get out, I just put those eye drops in and it does fine. Now that it's been over a month since I've had the surgery, I do wash my face and wash my eyes, but when I first had the surgery for the first month, I did not like wash around my eyes. But yeah, I still don't get water directly into my eyes. You can wear goggles if you want to protect your eyes from the water, or you can just close your eyes if you're like shampooing your hair. They also tell you to protect your eyes by wearing sunglasses. Trust me, your eyes will be light sensitive. Like my eyes are still light sensitive. And like I said, I had my surgery March 29th. We're in May. So I definitely recommend sunglasses. I got me a nice little collection. And it also tells you do not rub or touch your eyes. And this, they know, is the most important tip for recovery from LASIK eye surgery. And I made sure that no matter what, I did not rub or touch my eyes. And it could be kind of hard at certain points, especially like right after the surgery. But it's not ever unbearable. Like you can distract yourself or just like put eye drops in your eyes. And that usually kind of helped alleviate some of the dryness that you get, which would cause you to rub your eyes. Or just go to sleep. You know what I mean? Just go to sleep if it's really that bothersome to you. And for the first week, you'll have to wear sunglasses to sleep to make sure you don't rub your eyes while you sleep. If you have any questions, let me know. thank you guys for watching. Bye.